Right. So if you have read and understood considering a surgical anatomy station, kindly tell me what are you looking at?
Okay. So, ma'am, we are looking at the popliteal fossa
Okay.
of um, yeah, right knee.
Yes, of the right knee. Right. Can you please tell me the boundaries of the popliteal fossa?
So we have upper. It's a diamond-shaped structure basically.
Good. Yes.
So on upper lateral side, we have bicep femoris, lower lateral boundaries formed by the gastrocnemius, lateral heart of gastrocnemius and plantaris. Upper medial boundary is formed by semitendinosus and semimembranosus, and a lower medial boundary is formed by medial head of the gastrocnemius.
Good. Okay. What are the contents of the popliteal fossa? Superficial to deep, please.
So superficial to deep, superficially we have skin, we have the superficial and the deep fascia. Followed by it, we have tibial nerve, we have common peroneal nerve, and we have popliteal artery. Along with it, we have some lymph nodes, we have the short saphenous vein, and we have genicular branch of the obturator nerve as well.
Wait. What is the deepest structure of the popliteal fossa?
Popliteal artery.
Yes. So popliteal vein you should have mentioned earlier. Okay. Can you please tell
Sorry.
me how the knee joint is formed?
So knee joint is formed with it's between the medial and the lateral condyles of the femur. They articulate with the tibia only, with the superficial surface of the tibia, and not the femur. Not the fibula. Sorry, it's just the femur, the distal end of the femur with the proximal end of the tibia.
What type of joint is knee joint?
It's a hinge joint.
Okay, hinge type of synovial joint. Okay. What are the movements which are possible at the knee joint?
Ma'am, flexion and extension only.
Okay.
Flexion and
Which
extension of the
muscles
knee
are
joint.
responsible for these movements?
So, ma'am, flexors of the knee joint are basically our hamstrings. They flex the leg at the knee joint. That is, sorry. The knee joint would be flexed, flexed by hamstrings and extended by the quadriceps femoris, the quadriceps.
How would you confirm or check the knee reflex? What is the procedure and what dermatome does it check?
Ma'am, knee reflex is basically the dermatome is L2, L3 and L4. It will be checked by, we'll have the patient seated or with his legs hanging over the floor, not on the floor basically. A knee would be exposed. We'll hit the hammer on the patellar tendon, basically, which is the quadriceps femoris tendon. And there should be a, as a reflex, the leg will move forward.
This
In the knee
patella,
reflex.
okay, that should be when knee reflex can be absent, in which conditions?
Ma'am, knee reflex will be absent in what condition? Sorry, ma'am, I cannot recall.
Okay,
I'm so sorry.
This patella is formed in which tendon? What type of bone is patella?
Ma'am, it's a sesamoid bone.
Okay, formed in?
It's the largest sesamoid bone in the body, and it is formed in the tendon of this quadriceps femoris,
Can
which
you
itself is
mention?
formed by 4 muscles.
Okay, can you mention any other sesamoid bones that you know of in the body?
Ma'am, we have pisiform bone, which is a
Okay.
sesamoid bone, and we have other sesamoid bones in our great toe as well.
Okay. What are
Not
the
sure if it
structures
has a name.
which contribute to the stability of the knee joint?
Ma'am, knee joint is stabilized by a number of ligaments. We have anterior cruciate ligament, we have posterior cruciate ligament, we have the collateral ligaments, the medial and the lateral collateral ligaments of the knee, which support the knee from the sides, medially and laterally. And we also have the menisci, which act as a cushion between the two bones.
Okay.
And also secrete the synovial fluid.
All right. Just suppose there is a lump or a swelling in the popliteal fossa. So what are the differential diagnoses that you'll think of?
Ma'am, differentials would be, there could be a Baker's cyst, there could be a popliteal artery aneurysm, it could be a lipoma, it could be a mass itself, or
Schwannoma,
it could be
popliteal vein
schwannomas. Yes.
varicosities. Okay. All
Varicosities,
right.
yes.
What is from where the knee joint takes its blood supply, or what is the blood supply?
Ma'am, knee joint is basically, there are some genicular branches which are coming off from the superficial femoral artery. They form an anastomotic network over the knee joint. So we have medial and lateral genicular branches.
Can you please identify the structure 15 in left-hand side picture, please?
15, you are saying, ma'am?
Yes, please.
15 is the this is the common this is a common peroneal, this is a sciatic nerve.
Okay, then moving on to 17.
Ma'am, 17 would be a it would be a common peroneal nerve.
All right, 11, please, if you can identify.
11 is semimembranosus.
Good. Right, 13 over here, please.
13 is popliteal vein, I think.
Small sphenic vein. Okay, 16 over here, please.
16 would be, what is 16? 16 is some nerve. Not sure if this is ma'am, there's some nerve to it must be some muscular branch. I cannot make out which.
Okay. Right, if you can identify 14, please.
14.
If I tell you this is sural nerve, then tell me this sural nerve is branch of which nerve?
Oh, okay. So sural nerve comes off from the common peroneal.
Okay, and where is
tibial nerve? Sorry, tibial nerve.
Yes,
sorry.
tibial. So this 15
tibial
that
nerve,
you said, I don't know what. This is tibial nerve, 15. So
I'm
here
so sorry,
above,
yeah, tibial nerve.
Yes, here above would be common. So here it's just.
Yeah, I'm so sorry. Yeah, it is branching off. Yeah,
And
tibial nerve.
this 2 is going there. That is common peroneal. It's going at the back, behind. So
that is a common peroneal nerve.
Yes.
Yep.
So yes, this was correct. 11, semimembranosus. 14 was sural nerve, I told you this. And 13 was small sphenic vein. So yeah, good.
Sural nerve, yes.
If you can tell me what this 8 is.
Ma'am, 8 is popliteal artery.
Good, yes. And 10, if you can see 10 here.
Where is 10?
And if you pay close attention, then 8 is behind, the most behind, and then 10 is above 8. And then you have 15.
So that would be the popliteal vein.
Vein, yes, yes. Exactly in the order in which you have mentioned they are placed.
Right,
exactly.
right.
So in McMillan, it's given really nicely. Good, thank you.
Thank you so much, ma'am.
Take your timer, and here is your question.